Advantage was created so seniors could get health insurance through private companies instead of government-run plans. However, new reports show deceptive practices could actually be hurting health care for seniors and wasting tens of millions of taxpayer dollars every year. Joining us now to discuss this is OpenTheBook.com's Deputy Public Policy Editor, Rachel O'Brien. Good morning to you, Rachel. You know, this is really an eye-opening report.
Yeah, Jen, it's really terrible news. This is, these Medicare Advantage companies, they get reimbursed based on the risk score of their patients, how sick they are, which makes sense in a way. If you have a lot of medical conditions, your healthcare is going to be more expensive. But it also means companies like UnitedHealthCare and Humana can gain more profit when their patients are sicker. So they will often list many conditions on their patients' charts just to boost their, what they call their risk score, and they get more from the government. And so this has been found to be true. They deliberately seek patients that look sick on paper, but won't actually have high healthcare costs, just so they can boost that risk score. And this also allows the Medicare Advantage providers, these insurance companies, to reimburse doctors less money, about 11% less money than traditional Medicare, to treat their patients, and then they pocket the extra government funds. So it's a real scam.
This is a real scam. How much is this costing?
Yeah, so today, Medicare, 55% of Medicare recipients use Medicare Advantage. This is a relatively new program. It was created to give seniors more options. So United gives their patients a risk score that is 37% higher than normal. Humana's risk score is 19% higher than normal. To put it into dollar figures, on average, the federal government is paying UnitedHealthCare $786 more per person than for patients covered with smaller nonprofit companies. Humana is getting $423 more per person. So these deceptive practices have turned Medicare Advantage into a cash cow. It costs taxpayers 22% more than traditional Medicare, an extra $83 billion a year.
I think that's the bottom line here, is that what this means is that taxpayers are now basically lining the pockets of these insurance companies, these private insurance companies, as a result of this. So what is being done to stop it?
Yeah, and it's hurting patients. So the one potential solution is this House bill called the Prompt and Fair Pay Act. It would require Medicare Advantage plans to reimburse doctors at the same rate as normal Medicare. So that would disincentivize this favorable selection where they choose people who look sicker and they get more money out of it. So now they would have to pay doctors the same, which is really important because when doctors are seeing lower profit margins, they are no longer accepting this insurance in many cases. Medicare Advantage patients' insurance. A 2024 survey found that 35% of major health systems had dropped at least one Medicare Advantage plan because they're getting paid too little.
Yeah.
Another 45% were considering.
So it doesn't
that
really work. But I mean, that doesn't work then, because then doctors will no longer accept the insurance.
That's exactly right. And then now these patients who have Medicare Advantage, they have fewer options for care. They have fewer doctors who will treat them, which is the complete opposite of this program's intent, which is to give people more choices, more options. So Congress has this one bill. They've got to get this under control.
The question then becomes, how do they? Because as we just mentioned, this could also hurt the patients, the very patients it's supposed to be protecting here. So a lot more to come on this. OpenTheBook.com's Deputy Public Policy Editor, Rachel O'Brien. Thank you so much for joining us this morning. Happy Thanksgiving, by the way, to you and your family.
Thank you, Jan. Happy Thanksgiving to you.